In Nigeria, a dangerous problem hides in plain sight. Fake drugs and unapproved retailers. Fake or expired medicines from antibiotics to malaria treatment, painkillers and even controlled medications like opioids, peddled on the streets and cities by unlicensed, uninformed vendors. A perilous combo that puts millions of lives at risk. These medications look a lot like the real thing, but they can cause harm and have even caused death. In this report, we'll uncover the dangers, share insights, and find out what's being done so that we can fight this growing threat. To understand the scale of this crisis, we discussed with the expert, the CEO and Registrar of the Pharmacy Council of Nigeria, to be specific. The PCN is responsible for regulating and safeguarding the nation's drug supply, sales, and pharmaceutical practices.
Medicine that have wide margin of safety. Maybe you talk of something like vitamin C. When you talk of maybe overdose of vitamin C, you are talking of high volume of that drug, maybe in upwards of maybe grams. Maybe if, for instance, you say, okay, the overdose starts from maybe 6-7 grams, you are talking about 60-70 tablets, because each tablet is 100 milligrams. Before somebody can carelessly take that, that person must be out of sense. Even somebody out of sense, even for it to pass through the throat, it's a big challenge. So these are the class of drugs. So we are mindful that even though they are supposed to be in the underserved area, the class of drugs they are also supposed to sell is limited. Currently, we are embarking on the repositioning drive to improve PPMV regulation by having what you call Tier 1, Tier 2, and Tier 3. And the Tier 3, of course, are the pharmacy technicians. We have them in good number, and they also have capacity to handle much more drugs than Tier 1 and Tier 2. So this is where we are going. Then we're also bringing a concept called satellite farms. We are pharmacists. Unlike what it used to be, you just have a facility and then you remain there. We will allow for establishment of an extension, like an annex, in underserved areas with appropriate supervision, so that people in those locations can also have access to medicines, wide range of medicine, even prescribed medicines, but under the proper supervision of a pharmacist. That is what we mean by satellite pharmacy concept. So these are steps we are taking to improve access to medicines.
Concerned Nigerians acknowledge that indeed there is a fast rising trend of fake drugs and unlicensed drug peddlers. They share insights on why Nigerians still patronize unlicensed drug sellers, even though they may be aware of the dangers associated.
I see those outside guys, they will be passing with some drugs, selling on the roads. I don't know where they get the license from, and it's very bad. And for me now, I'm a nobody. I know I'm a citizen of this country. I have right to stop them, to ask them where they get the license from. But the problem is that if you do it past your power, maybe the government is backing them sometimes.
In Nigeria, everything goes. Fake drugs goes, fake everything goes, and nobody is monitoring it. Even the NAFDAC that is supposed to be monitoring all these our drugs, or even anything that is done that is consumable, that is supposed to be approved by them before it enters the market, they don't even take any action anymore. Because when you start talking about those, what of the agbo we drink on the road every time? So many people are diverting to agbo because they cannot afford the normal pharmaceutical drugs. You understand?
Okay, about that, I am not in support of selling drugs on the street. For instance, most times when I enter the coastal bus, I see people marketing drugs in the bus, because it's not advisable for one to start taking medication without consulting a doctor. You don't know what is wrong with you, and you just start taking medicine. That is an abuse of drugs. So my take on this is that anyone that has any health challenge should first of all go to the doctor.
Only what we need sensitization, both on the social medias and all the medias, that if there are some particular evidences we need to look at to be able to know whether this pharmacies is genuine or is not genuine, because most especially in the villages we rush into pharmacies and lo and behold our problem are solved. So issue of knowing whether it's registered or it's not registered does not arise to us, to most of us that are living in the villages. Thank you.
The numbers are staggering. Over 120 deaths annually in Africa are attributed to counterfeit drugs, according to the World Health Organization. In Nigeria alone, fake medications account for a significant percentage of reported adverse drug reaction, costing billions in economic losses and public trust. The Pharmacy Council of Nigeria is stepping up to address this epidemic through intensified crackdown on illegal sellers, stricter regulation on drug importation, and widespread public awareness campaign. They are paving the way for safer healthcare practices. But the fight is far from over. The PCN emphasizes that public vigilance is key. Buy from licensed pharmacies, verify medications, and report suspicious activities to the PCN.
Still to know that one of the biggest operations we have done together in recent time was the closure of the open drug market in Kano. We did it jointly with NAFDAC, and the two directors of enforcement, PCN and NAFDAC, coordinated that operation with myself and DG NAFDAC on the background, giving guidance that led to the successful operation in Kano, which of course led us to closure of about 1,321 unregistered facilities, illegal facilities in that location. We have moved them to what you call coordinated wholesale center in Kano. Principal or cardinal responsibility of the task force is to go after the hawkers and people, anybody, anywhere that is selling drug in unregistered facilities, because they are the major, including the open drug market, which of course you have in Lagos, Idumota, you have in Onitsha, Overhead Bridge, you have in Abia State in Ariara. Of course, we just closed that off in Gombe too. We also closed one in Kaduna and Zaria. We will continue to do this. We did all this year. We will continue to do this to ensure that we streamline drug distribution, because it's the chaotic drug distribution. Even if you have the wrong one and you don't have a place to sell it, because where you can take to is a regulated facility, you will be very careful because the person there knows that he's being watched out for. But of course, in a facility that is not under regulation, purview of regulation, can afford to do anything. So that is why we are doing everything possible to eliminate it. What is expected or what is required of any premises that is duly licensed is for the original license to be conspicuously displayed, not just the photocopy that you can easily tamper with. It's the original license, and each license expires 31st December of any year, and then the new one starts from 1st January of this following year. So always look out for one, the address on the license, because the license may be in one location and then the address may be in another location. That is enough for you to know that that license is fake. Always try to also look out for the original copy of the license, because when people put up photocopies, chances are that they can easily be tampered with, the original being tampered with. These are some of the things. And nothing stops you, especially for pharmacies, to ask to see the pharmacist, to ask some questions. And that will also help you to know whether the facility is actually under the superintendent supervision of a pharmacist.
The infiltration of fake drugs is a national emergency demanding collective action. As citizens, we must stay informed, stay vigilant, and stand united to fight for a healthier Nigeria. If you suspect counterfeit drugs or unlicensed sellers in your area, contact the PCN. Your vigilance could save a life.